Gire is one of the local government areas in Adamawa state affected by the issue of farmer and herders clashes, which has resulted in the displacement of many people. Ahmed Omar is a community-oriented resource person in Wurokoda in Gire local government trained by the European Union and UNICEF to take responsibility of the community in terms of healthcare service delivery to his people. He applauds the giant stride of the EU and UNICEF for bringing such initiative, which has gone a long way in boosting the health status of the people of Wurokoda. He adds that such initiatives should be strengthened so that people can benefit more in terms of healthcare delivery. I'm happy to see myself helping my community in terms of contributing my quota as a community-oriented resource person. When I was trained by the EU and UNICEF, I did not know I would be so helpful to my community. Glory to God, the people of my community hardly fall sick because of my quick intervention. Thanks to the EU and UNICEF for this giant stride. We need more of such initiatives so that our people can benefit more. Being a resource person is not an easy task, but I thank God I'm able to use it and derive pleasure in the work. On his part, the village head of Wurokoda, who is also a beneficiary of the EU-UNICEF initiative, said, through the initiative, the people of his community hardly fall sick because there is someone trained to take care of their health challenges. EU-UNICEF has done great things to my community health-wise. The trained community-oriented resource person, our community is somehow free from minor sicknesses that usually disturb our women, children, and the rest. Most importantly, with this initiative, our pregnant women have free and successful delivery. Seriously, we appreciate EU and UNICEF for this great work. Some of the beneficiaries in the hard-to-reach community of Wurokoda thank the European Union and UNICEF for taking their communities into consideration and having trained one of them to take care of their health challenges. My family has benefited a lot from this EU-UNICEF initiative because we have free treatment, free drugs, and many other things. Our community is lucky to have community-oriented resource persons who can take care of our health. You can see my children happy and healthy. I'm in a community that cannot find any clinic. With the coming of the community-oriented resource person, some of our challenges are being addressed with immediate effect. As you can see, we are living in a remote area, but thanks to the EU, UNICEF for this great initiative. We appeal to government to do everything possible to complement the effort of the EU and UNICEF in providing enough medical facilities for our community. Seriously, this initiative is helping us in so many ways because for us, we can't have access to CT, not to talk of accessing some of the healthcare services. But with this development, we are content with the efforts of EU and UNICEF in our hard-to-reach community. We hardly got treated before in our community, but ever since we have our own community-oriented resource person, things have changed. We have free drugs, free treatment, free delivery of our women, and so many things. In fact, we are benefiting and enjoying this kind gesture from EU and UNICEF. 90 community-oriented resource persons are trained by the European Union and UNICEF in Gire local government area to assist in healthcare delivery services.